Good morning, everyone, and welcome back to the GuideWell Connect Insights Lounge. We're here at day 3 of the AHIP Institute and Expo. Welcome, everyone. My name is Kate Warnock, and I have a very distinguished guest here with us at the GuideWell Connect Insights Lounge, Dr. Farzad Mostashari.
Hi.
Hi, well, welcome. Welcome so much.
Thank
You literally just came back from giving your presentation. Maybe give us a little recap of what you just presented on stage.
It was really about data and how do we turn data into insights, into action. And one of the things that makes this time around different, I believe, from previous attempts at getting to better care at lower cost is the availability of the infrastructure that I worked very hard for many years to get done, the digital infrastructure in American healthcare. But also, what do you do with that data once you have it? And how do you turn that data into something that actually makes a difference in how care is practiced? And this is the yin and the yang of payment reform and delivery transformation. And I believe that data and information systems are going to play a critical role in helping us succeed this time.
You know, Dr. Mostashari, you're obviously a champion of the provider, you yourself being a clinician yourself, but I was hoping you could help kind of shed some light on, we know that interoperability is such an issue for the large health system. What do you do? How do you advise the small independent practitioner who also wants to benefit from this big data that you say will be so transformative?
So the good news is that we now have tools that are cloud-based. And so the smallest practice can take advantage of systems that previously were only in the purview of Kaiser. That's the good news. The bad news is that small practices still face many, many disadvantages if they're atomic. And I think the big theme with MACRA, maybe we'll get to that, but with the changes coming in healthcare and the greater and greater demands from a reporting, administrative, compliance, and value-based payment on small practices, it's going to be very, very hard to stay absolutely atomic. And practices are going to have to figure out, do I become an employee? Do I retire? Do I check out? Or do I band together with other small practices in networks? And this is if there's one kind of message of hope that I want to give to those independent practices who want to stay independent is there is a third way. There are now organizations like ours and others, you can create virtual groups and come together and get the support you need to do the reporting stuff, to do the population health stuff, to do the ACO contracting, but don't change your independence because that autonomy, that ability to act in the patient's best interest, not in any corporate interest, is at the heart of what's best about medicine.
All right, perfect lead into our next question then is how do you see this independent practitioner that you value so well competing against larger consolidated practices who have the resources to offer those extended services, transportation, home-based monitoring, all those things which can impact quality scores and reimbursement? How do they compete?
Here's the thing. You might think that the Goliaths have an advantage here, but they actually don't. If you look at the data, small practices have lower readmission rates, they have lower costs, they have higher patient satisfaction, they have higher patient engagement. The one thing they lack is market power. So where they are massively disadvantaged compared to the larger consolidated systems is actually fee-for-service, and everyone knows this, right? When you go into a contract negotiation, if you're a price taker from a plan, then you're not going to be paid much. If you're a price giver, if you're a big consolidated monopolistic consolidated health system, then the health system gets paid more, but the doc doesn't necessarily. So population health actually plays to the advantages of groups that don't have to worry about keeping the beds full, the procedure suite humming, the operating suite going.
Right.
So if you don't have to worry about demand destruction, which is what health systems call it when patients are healthy, right? Then you actually have a massive advantage. And small practices really can outperform consolidated health systems on all of those population health measures. The key is to have the right people in the boat with you, rowing together, and having the right coxswain or coach.
So again, it's that going back to that virtual arrangement that you were just referencing. That's maybe another way to scale, but again, without giving up that autonomy.
Exactly.
Okay, terrific. That's new to me. I wasn't aware that arrangement even existed, so good to know.
It's called Aledade.
Ah, there we go. Of course, I apologize. You are Of course, the former head of the ONC, but you are also the CEO of Aledade. So
Yes.
good, great to know.
Disclosure.
So, all right. Thanks for hanging in there with me. So, all right, Dr. Mostashari, this question comes from our own Chief Operating Officer back at Guidewell. He wanted to know, it seems that every time there are new payment rules issued, there are significant impacts to infrastructure.
Yeah.
And we can use the most recent macro announcement. What's your advice to CIOs who live in this world of flux?
Yeah, that's a great question. And the CIOs are more and more becoming strategic rather than operational only in health systems. Mm-hmm. And their role has got to be to anticipate what the organization is going to need in the future. And I think the ability of organizations to succeed is, as I started off saying, going to depend crucially on their ability to do a few things with data. One is generate insights from that data, not just have the trains running, but have that data be accessible for insights. Mm-hmm. Two, to create a learning infrastructure, a platform where the organization can learn from what it's doing, to do little experiments, to do randomization, to try something one place and instrument. We instrument our patients in the hospital, but we don't instrument ourselves. What are we doing? What are the interventions we're doing, and what are the outcomes we're getting? If we can instrument the interventions and the outcomes, we can learn. And that, to me, my best advice to any CIO would be, there is nothing that you can predict. Like, we're going to need more cath labs, or we're going to need more radiology intelligence or AI. You can't know that. What you can know is the future is going to be changing, and the more you can learn, the more you can become a learning system that instruments itself, that learns from itself, the better your organization is going to be.
Great advice. All right, we have one more question for you. Obviously, you're also an expert on ACOs. Wondering, how do you see ACOs evolving, and how might the consumer continue to benefit from these kind of arrangements?
Yeah. So there have been some recent developments around accountable care organizations that I think are incredibly positive. And to me, the big message coming out of all the tweaks and the new models and the next-gen model and the benchmark rule and the MACRA and the MIPS and whatever, the main message here is that there is a commitment on the part of CMS, importantly leading this, to get it right. And they're going to continue to iterate and evolve this. But fundamentally, the world in which I believe we're going to have three kind of permanent types of care in our society. There's going to be managed care, HMOs, Medicare Advantage, where people, there's going to be a lot of so-called benefit design, right? Who you can see, who you can't see, mm-hmm. what you can get, what you can't get. And, that can be great for a lot of people. And then you're going to have totally unmanaged fee-for-service, PPO, like you go to whoever you want to, but you're in charge, right? It's you who has to manage and coordinate everything about your care. You have no one who's going to be your quarterback or your coach, right? Mm-hmm. That's fee-for-service, this is managed care, and I think there's going to be something in the middle where you have someone who is accountable, who feels accountable for you, but they nudge you and they influence you. It's not hard, it's soft influence. Mm-hmm. Okay. That to me is the core of accountable care.
Very, very fascinating, interesting, look ahead. So, all right, so let's say it one more time. Dr. Farzad Mostashari is the CEO of Aledade. So I know that folks are familiar with you, but it doesn't hurt to say that you're in charge of this wonderful new company. So, all right, Dr.
2 years old.
2 years in the market,
today.
yes. And so that's been, with the bow tie and the announcement when you left the ONC, I certainly follow you on Twitter, and so wonderful to see you.
Oh yeah, Farzad_MD.
That's right, with 28,000 followers. I keep track, so we're coming in, we're closing on 30,000 followers. So, well, thank you so much for spending your time with us here at the Guidewell Connect Insights Lounge. We're going to be up with another interview in just a moment.